Muted.
Okay, welcome to the project of state assessment for collaboration for EHDI and early intervention. I'm Jerry Clark from the Division of Specialized Care for Children. With funds that we have from our HRSA grant to reduce loss to follow-up, we've been able to contract with Tracy Meehan to facilitate the project. Using the EHDI system self-assessment tool. Results from this work group's use of this tool will help public health, early intervention, and DSCC, the three partners in the Illinois EHDI program, plan for future efforts. Tracy has been involved in both early intervention and EHDI through her work on the Aim to Be Ahead grant for certification of DTHs. Tracy, I'm going to turn it over to you.
All right, thank you very much, Jerry. Looks like we have a nice group here. I'm turning on my webcam for just a second so everybody can visually allow me to introduce myself. And thank you for your time today in this important work project. I'm very excited to be working with all of you in one big group, and I hope you find this introductory webinar really a good starting block for all of us, getting us on the same page, taking a look at some of the tools we're going to be using when we move forward to our face-to-face meetings. And as Jerry said, my name is Tracy Meehan. For those of you who don't know me already, I work full-time at Illinois State University. I also work in early intervention as a direct service provider for oral rehab services for families who have young children diagnosed with hearing loss. I wanted to just remind those that have questions, you are muted during the presentation since I'm the one with the microphone. And so you can write your questions in the chat box. If we have time at the end, of course, we'll address all of them, and if not, they'll be addressed via email. So thank you again for your time, and let's get started. I'm going to minimize the webcam now, so goodbye to everybody, and move back to the PowerPoint. You've received an outline for today's webinar, our short time together, so hopefully you could take a look at that and see how we're going to progress through our short time together. So who brought us all together? The Illinois Department of Public Health, Division of Specialized Care for Children, and the Department of Human Services, Early Intervention. Our three state agencies all share a commitment to improving outcomes for young children, and specifically for young children who have hearing loss. Here are the contacts in those agencies and those who believe in this opportunity for improvement. I'm honored to be working with these agencies and each of these people personally. I want to thank them for this opportunity to facilitate this work group. I've been in deaf education for over 30 years, really over 35 years, and my passion and interest in most recent is really through this early intervention and early learning. Many of you have been present at various stakeholder events, and that data and input will be reviewed in our upcoming face-to-face meetings. All of us agree to these EHDI actions, and all of us are collaborating to improve loss to follow-up, to increase enrollment in early intervention, and to be able to document improvements with action, data, and numbers. You're going to see some of this data in a minute. But one agency can't do this alone. Three agencies really need our support, and this work group will be the avenue we're taking to reach that objective you see printed on the outline, to establish a baseline for Illinois as related to the Joint Commission on Infant Hearing recommendations, using the state assessment tool to identify priorities and develop actions for improvement that are feasible within our state. So with the communication between the 3 state agencies all having a shared interest in improvement, this work group was created, as Jerry defined. Feels a bit like Mount St. Helens eruption in 1980 today, as it always feels when we start something new. Now, you should have received documents through the email group. One was the Joint Commission on Infant Hearing position paper with the 12 recommendations in background. One was a single page with the list of the JCIH recommendations. And the third was the state assessment tool, which we're going to be talking about today. You see the job ahead of us. Other states have used the state assessment tool and have been able to implement and create real change for their EHDI programs. Specifically, Minnesota, North Carolina, Georgia, and Maine. They've all shared lessons and suggestions about the process they took. So just a bit of background. The Illinois State Board of Ed created a joint task force about 9 years ago. And this task force took on 2 jobs. One was the task force looked at writing an EI task force report, which was submitted in 2007. And the second was the Deaf and Hard of Hearing Educational Options, sent to ISBE in 2008. They called for ongoing coordination between IDPH and EHDI, and now we're at another critical point of moving forward with the Early Intervention Bureau joining the collaborative team. This early report developed and detailed issues and objectives and actions, all leading toward one goal written per issue. For your reference, the website where you can read this report has been provided. As you read this earlier report, you'll see where some of the quality improvements recommended are in place here in Illinois. All of this proactive work was done at the same time the JCIH was developing their recommendation. We were forerunners. So this national document, most are very familiar with it, the supplement to the Joint Committee on Infant Hearing. And this supplement provides comprehensive guidelines for EHDI programs on establishing strong systems with appropriate expertise to meet the needs of children who are deaf and hard of hearing. Although these guidelines describe best practices in early intervention, they do not specify the exact means to identify where an organization might be in terms of achievement, nor do they guide the stages of moving towards higher levels of quality. The ongoing use of an EHDI self-assessment can provide a tangible means of guiding and driving and aligning partners in the EHDI system. This will be our guide as we approach the first task of completing the state self-assessment, prioritizing outcomes for Illinois. This slide matches the single sheet you were sent listing the 12 recommendations. I really feel that this supplement and the document itself should be part of your bedside table reading. It certainly will be for the next 3 months. Now, we recognize that these 12 goals are all important. But as a state, for us to discuss and set our objectives, they must be prioritized with specific actions developed that can be measured and documented using the resources and partnerships we've established. In other words, the actions must be feasible for Illinois. We've learned from other states some valuable lessons about engaging in a self-assessment process. But what will work for our state? A self-assessment process allows a variety of stakeholders to participate and gives us an avenue to explore our systems and work collaboratively. It's a way to evaluate our gaps and needs in agencies and systems, and it puts numbers with actions so we can be measurable and accountable. We'll be working together for 3 days and using this model. What do we want to accomplish? Several specific objectives will be improving our loss to follow-up and families' enrollment in early intervention, but there'll be others. We need to establish how we'll know that our changes are creating improvements. This will come from identifying feasible recommendations to work on and creating the action plans. And feedback to our stakeholder group as we move forward is crucial as changes begin to be implemented. And at this time, I'd like to turn the microphone over to Ginger Mullins to give us a little perspective on some of the data here in Illinois. So Ginger, I can advance the slides and the microphone will be turned over to you.
Thank you, Tracy. Thank you, Tracy. I think hopefully everybody can hear me.
I can.
The slide that you see on the front of you, before you, is looking at how many kids in our system or in our state actually refer at time of discharge and at time of final screening. So you can see that the cohort of kids that we're talking about is about 3.2% of the general population do not pass at time of discharge, and about 1.25% that actually fail their final screening before they go to an audiologist. So people always ask, how many kids are we talking about? There's how many kids we're talking about at screening, and we'll move to the next slide. Then when we talk about the number of kids who actually have a diagnosed hearing loss, that's reflected in this slide here. Even though our birth rate has declined from when newborn hearing screening was initially started in Illinois, declined by about 30,000 births, our reported cases of hearing loss has increased. And we're creeping up on about 300 children that the Department of Public Health was notified about and for the 2015 birth year. We'll go to the next slide. When you translate that into the incidence per 1,000, we're currently at 1.9 per 1,000, which is greater than the national average of 1.5. But we desperately feel like there's quite a few children who are not reported to the State Department of Public Health. Therefore, we're not sure if they're getting services or not, whether those are private or Part C early intervention services. To speak briefly about the kids that are lost, we'll go to the next slide. This is our children that are lost between screening and diagnosis, lost to follow-up. So although our percentage as calculated by the CDC with a special algorithm, although that percentage is declining rapidly in the last several years, we still have about 800 children that didn't pass newborn hearing screening and never got to diagnostics or were never reported to the State Department of Public Health. So that's just the situation with getting to diagnostics. With early intervention, we currently don't have a two-way communication mechanism to be able to consistently, easily, timely track if those children who have a confirmed loss actually got into intervention services. With the help of the Bureau, we're working on that, and I will share more data regarding that on our July 22nd meeting, kind of in detail about where some of those gaps lie. In general, though, Illinois does have a higher than the national average number of children enrolled in early intervention, so that's a positive news, but there's still a large group of children that we don't know about, and in addition, there's a large group of children that we don't know were they enrolled in early intervention related to hearing loss or some other disorder. So those will be things that we talk about more on the 22nd. Thanks, Tracy.
Okay, thanks, Ginger. Certainly a brief overview, but enough to give us things to think about. As we really move into the task, I'd like to talk about completion of this self-assessment tool. So let's get started in introducing the tool. So you received the document that contains good rationale and background, and the document that other states I listed have used. We're going to use this for review today. But when you begin completing your survey, you're going to be doing that on a SurveyMonkey link that you'll find at the end of this PowerPoint, and in addition will be sent to you immediately following this webinar. So for the purpose of today, just know that you'll receive an email with the SurveyMonkey link with all of the material that we're going to be talking about. You'll also receive the document as an attachment if you'd like to print a hard copy. And I do want to remind you, if you're taking notes, to use Google Chrome as your browser when you complete that survey. Now, the purpose of the tool is to help prioritize, as I said earlier, where to start implementing the JCIH recommendation. We agree they're all important, but need to find out what Illinois is doing well, where our gaps lie, what's important to the stakeholders, and most importantly, what's feasible to undertake for quality improvement. So I'm going to pull up the document now.
Tracy, this is Barry. I need to interrupt for just a minute. One of our members is asking if you could please put your camera back on so they can see you while you're talking.
Okay, yes, I can. Can you see the document in front of you now?
Yes.
Okay, good. Let me try to put my webcam on. People can see me. Is that better?
Thank you.
It's just, I'm going to have to move it over just to, although I like looking at myself, let me move it over here. Okay. Okay, so now you have the document, and what I'd like you to do, let me scroll up to the beginning. Here's the start. And when you start reading through it, you're going to see suggestions for application, this scoring table, which I'm going to get to in just a minute, and the goals, which we've reviewed. But I'd like you to scroll down to page 7. And for the purpose of an example, I chose goal number 3. All children, all children who are deaf or hard of hearing from birth to 3 years of age and their families have EI providers who have the professional qualifications and core knowledge and skills to optimize the child's development and child-family well-being. So that corresponds to the list that you have of the JCIH goal recommendations, and here you see in the document, the self-assessment tool, large data there, a rationale and some history that you can read as you're starting to go through the survey itself. Now, the reason I chose to use the document itself today and not show you the SurveyMonkey, because all of this rationale is not a part of that document. So you're going to want to use them, tandemly, back and forth. It's going to take some time to be able to familiarize yourself with each goal. So as you look through the document on that goal 3, and you go to the next page 8, you'll see that each goal area has sub-actions. So all 12 of the goals have sub-actions, and this goal that we're using for our example has 3.1 to 3.6. So when you're taking the survey, each one of those will be ranked and scored here across the capability levels. So I'm going to go to the top of the document where it talks about the capability levels. Now, for those of you that go back to review or rehear the webinar, there are slides in the webinar that address exactly what I'm saying. But for those of us on live, you can see the screen and it's a little easier to incorporate. So the ratings are 4 ratings called capability levels, and then the description of that level is on the right. So you'll see the first one, the 1, is nothing in place. So the EHDI system has not yet begun to address this component. So from your work and your experience and your background, you'll be scoring what you think on each of those sub-skills. 2 is just beginning. So the EHDI system for this component is at an early stage or period. 3, making good progress. The EHDI system for this component has made satisfactory development, growth, or advancement. And then number 4, the EHDI system for this component conforms to accepted standards. So those are your capability, those are your rankings that you're thinking on each of the 12 recommendation and all of the sub-skills. So I'm going to scroll back down to our example of number 3, just so you can see the task ahead of you. So for 3.1, you'll be reading that sub-area and from your perspective scoring 1, 2, 3, or 4 using those same capability descriptions I just read. Now I want to address this 5th column here, the priority with the question mark column. Those priorities are going to be set as part of the work group. So you may feel like individually you'd like to jot that down on this assessment and bring that to the work group, and that's great. But when you complete the survey on the SurveyMonkey link, you will not see that column. So don't be alarmed that we forgot the column. The priority is going to be part of the work group. So the reason, of course, to use the SurveyMonkey is so we can have a nice, clear analysis of the data that comes in from the stakeholders to be able to hit the ground running July 22nd when we get together. So I'm asking for the completion of your self-assessment to be done by July 10th. So if anyone can put that on their calendar. So just scrolling quickly for just a minute, and you have it in front of you, so I know you've been looking. You'll see goal 4 with the sub areas and so on and so forth. So everybody knows the task and knows what we're attempting to do and collect data from our stakeholders.
Tracy, we do have a question in the chat box. Would a person responding to the survey respond based on the individual agency they are employed under or by the associated program they work under? Basically, would a service coordinator respond based on the CFC he or she works for, or would they respond the way they feel early intervention works?
Well, that's a good question. I would think as a stakeholder you would respond individually. I don't see that question, but I'll refer back to it, sorry. We do, I didn't say that we will have representation from the Child and Family Connections offices. It was really our commitment as a core committee to engage the entire state. So we want statewide representation, and we will be having that on the work group. So we'll look forward to being able to hear from all parts of the state. So you see these few slides are just walking through what I did with the document for those that will be viewing this on a recorded. So we all have different backgrounds. It makes for a rich discussion, and it will assure the outcomes will reach the widest audience. my webcam's not on anymore.
Yes, it is.
You can see me?
Yes.
Okay, good. I can't see it, but that's good. So by completing the self-assessment tool, we're objectively looking at the strengths and barriers in meeting those 12 JCIH recommendations. The larger meeting will work on prioritizing, as I've said, they're all important. But is it feasible for us to act on all 12 recommendations? Or will the data show us that we should be focusing our efforts on 2 or 3 and go into more depth? So feasibility focusing on helping to answer these essential questions about how to proceed. It helps determine the viability of seeing something through completion in our state and not just recognizing that we think it's important. We'll be narrowing down these recommendations from the data collected. So when you see the survey that comes to you from the SurveyMonkey link, you'll have an opportunity to take all 12 recommendations and rank them for importance and for feasibility, in addition to ranking all of those sub-skills. We have some preliminary data with this tool. There were EI service providers that took this at a conference, Bridges Conference, hosted at Illinois State University for professionals working in early intervention. It was a small group of stakeholders, but we do have that data, and we'll be using that as part of the larger group and implementing that data with the data that we collect this time. So where are we going? We have work to do. And what's our future direction? Well, we know we're engaged in the webinar now. We know we have our face-to-face work group meetings coming up on July 22nd, August 26th, and September 23rd. They'll be held in Springfield, and the location will be coming as soon as it's finalized. And as those meetings happen, there may be an opportunity for smaller committees to meet via teleconferencing. Don't know yet until we actually get together. So on this slide, you'll see the link that should take you directly to the self-assessment tool that I've been talking about, which will come out immediately following the webinar. The recorded version of the webinar will be up and running sometime next week, and I'll also be notifying you of that when it is available to view. So let me take a minute to pull up what you're going to be seeing when you go on the link for the SurveyMonkey. Jerry, can I ask, is that visible?
Yes, it is.
Okay, thank you. So you'll see the dear stakeholder asking for a little data. And then as I referenced, you'll see the 12 recommendations on the left column there and ranking them by importance. So we'll scroll through all 12. And the next data collection point, as we talked about, shorter term feasibility in our state. So you'll have an opportunity to take, again, thoughtful comments about all 12 recommendations in the feasibility. And then here you'll notice goal 1 begins just as we saw on the self-assessment tool, begins with those sub-skills listed on the left column. The same capability ratings we discussed are present here, nothing in place, just beginning, making good progress, established practice, and then a column here if it's unknown to you, if you can't assess that, if you don't have a strong feeling about how to assess that. So I wanted to show you what the document will look like. As I mentioned, it'll be a hard copy attached to your email. You'll also have the link to be able to take it. So we have some time for questions and can open that up. So let's see what's in the chat box. I don't see any questions, but...
Okay, so Ginger has responded to Ann's question about early intervention CFC people. And she's suggesting that perhaps they should be answering questions based on their perception of where the state is at on a whole. So I think basically it's do the best you can with your knowledge of how EHDI and early intervention work. Then there was another question about if you are uncertain of how to, or don't know an answer, and I think you answered that a bit with your demonstration of the SurveyMonkey.
Right, good, thank you. I do see that question now. So if you're unsure, and instead of leaving it blank, you can just click that, that last box. Of course, we're not asking you to do the first document I showed you. That's a reference that all the states use. We've incorporated those sub-skills for you to take it as a survey where we can gather and analyze the data.
Okay, we're being asked now if we could go over feasibility versus importance again.
Yes. Let me just go back. The purpose of thinking about importance and feasibility is going back to the notion of how is Illinois going to progress? How are we going to see real change that's effective, measurable, and data-driven? So would it be in our best interest in Illinois to tackle all 12 of the recommendations with action plans? We'll see with the data and the priorities. Or is it going to be more feasible to look at 2 or 3 of the recommendations in depth? So recognizing, and we don't need to spend time discussing how important the recommendations are. They've already been established as important. All 12 of them are important. But how is Illinois going to move forward? What's feasible for us as practitioners and agencies given what we know about Illinois and our background and our history? So that's the definition and the lens of feasibility and importance. And not sure, Sally, if that answered your question. Did it help? Ginger added, think about the state of the state and can we easily accomplish an activity? The purpose of the work group is not to discuss the recommendations of the JCIH. The purpose of the work group is to use that model of improvement and to create and implement change, positive change, moving forward.
This is Jerry, and I would also say in considering feasibility is, in the state, in our fiscal situation, we're not going to have a pile of money to throw at something. So that is going to have to be one of the considerations we have in determining what's feasible.
Right. Right. That, I think, is a lens that all of us that work in Illinois in any kind of agency program or an individual provider, we all feel that, and we don't want that to be the biggest barrier, or we wouldn't be engaging in the work group process. But certainly needs to be part of the lens that we're wearing when we complete the assessment tool. Let me check for another question. There will be a section, oh no, okay. I don't see any other questions. Would anyone else like to see either of the documents again, or?
While people are kind of having their last thoughts and trying to figure out if they want to pose another question or make another statement, I want to just announce that we will have this recording available, but it probably will be next week. And so please be patient. We will send that information out to you as soon as we can.
Okay.
Okay, there's a question now about logistics of using the survey.
Can we log on and off the survey, or we do it at once and just figure out how much time to allow? Ginger, do you have any experience with the Survey Monkeys? You'll need to do it all at one time. Good question, Sally. So again, having the document, the self-assessment tool, and then the hard attachment that I'm sending the Survey Monkey, you'll have time to sort of walk through it and read and go back and look at the rationale instead of just sitting down and taking the survey right away. You'll have the documents and be able to spend 2 or 3 weeks taking a look at them, since you have till July 10th to actually complete the survey. But an excellent question. So I hope you'll be able to use both the documents that I sent previously and then the one that's coming, which will be a hard copy of the survey itself. Good question. Right, okay. Well, that's not coming from my end, but I like it.
Sorry about that. That's my daughter.
Well, I hope everybody found that this introductory webinar was helpful, gives us some common footing, introduces people and the stakeholders that brought us all together, which is one of the most important features. And if there aren't any other questions, I'll stay on the line for a few more minutes and then be sure to get this out to you promptly. Anybody from the audience have a question they'd like to comment?
I'm going to go ahead and stop the recording.